शेयर करें एक बार आप सबकी जोरदार तालियों के साथ वी वेलकम डॉक्टर श्याम भट्ट ऑन द स्टेज। सुपर्णा का भी स्वागत है और रिक्वेस्ट है मिस्ट्रीज ऑफ माइंड के क्या क्या पहलू और क्या क्या डायमेंशंस और क्या क्या परतें हम सबके सामने रिवील हो सकती हैं, कोशिश करते हैं, देखते हैं और जुड़ते हैं।
शुक्रिया जनेंद्र जी। गुड इवनिंग वंस अगेन। Before I begin, I'm intrigued to see the numbers gracing this session, the kind of people from City Beautiful who are interested not only to meet an illustrious writer, an acclaimed psychiatrist, but also learn perhaps what is misunderstood largely as mental health illnesses. We are not going to focus on case studies. We are not going to distract ourselves with highlighted projections of celebrities who have shared their unhappy moments of life. We are here to delve into something more substantive, and that is 250 ग्राम का ये जो मगज है ये अटकेलियाँ करता है, और जब ये अटकेलियाँ करता है तो ये दिक्कतें पैदा करता है। ये व्यक्तिगत रूप से हम में से सभी यहाँ भद्र पुरुष और विख्यात लेखक जो शामिल हुए हैं महसूस कर चुके हैं कि वातावरण थोड़ा सा तंगदिल होता जा रहा है। It's becoming suffocating for oneself. The isolation of living in a large world connected very integrally to technology, to information. Click of a mouse gets you everything. 1 picosecond can make you famous. Things go viral. So 250 grams up here goes haywire. And we are here for the next 40 minutes to talk about few elements which seem to become more and more essential for a discourse of the kind that Literati here is presenting. Mysteries of the mind. Depression, anxiety, and similar health issues are on the rise today, as we all know. There is a survey that was recently conducted by National Mental Health Organization, and the stats that come out are astounding. 13.7% of India's general population, 13.7%, has various mental disorders. 10.6 of this number requires immediate intervention. The gravity of the situation, ladies and gentlemen, is right in front of you. I would be failing in my duty were I not to, for a minute, request you to ponder on the term which is rather loosely and very frivolously, casually used these days, depression. उसे डिप्रेशन हो गया, चुपचाप से रहती है, गुमसुम रहती है, बात नहीं, डिप्रेशन होगा। ये ना जानते हुए कि शायद आप एक गलत सिचुएशन में एक गलत आइडेंटिफिकेशन एलोकेट कर रहे हैं महज इस शब्द के प्रयोग से। So my first question to you, Dr. Bhat, is please elucidate on how a normal person, a regular common mind should understand this term called depression, because एक स्कूल है जो आजकल बहुत पतली सी धारा रखता है डिप्रेशन और सैडनेस के बीच में, और उनका ये मानना है that sadness is a positive state. Quite obviously depression is not. Your thoughts?
Thank you, Suparna, and just want to take this opportunity to thank you and CLS. It's wonderful to be here in Chandigarh. This is such a wonderful city. I was here 20 years ago when I was in medical college on the way to Shimla, and I should have spent more time.
Pleasure.
It's hard to believe that people can feel depressed in an environment like this, but the truth is that depression can strike anyone, anywhere, no matter what the circumstances. It's not the same as sadness, although sadness is a common feature of clinical depression.
Right.
Now, the terminology, I think, as you said, is an issue. We all say depression, we all feel sad sometimes, we say I'm feeling depressed. But unless you have gone through clinical depression or worked in that field, it's very hard to understand what clinical depression is. Clinical depression affects the brain and the body, and therefore the mind. People feel not just sad, but they lose interest or pleasure in doing anything and everything that they found interest in doing before.
Right.
It affects biological functions like sleep, either you sleep too much or too little. Appetite, either you eat too much or too little. People can become irritable, angry, lose their patience, find it difficult to concentrate and focus, have lowered energy, lower self-esteem, inappropriate regret and guilt. And life seems very bleak, very difficult to live, in fact, and that's why 10% of people with clinical depression will commit suicide. The mortality rate is 10%. 160,000 people commit suicide in this country every year, and out of that 160,000, at least 80% have some clinical issue like depression, anxiety, or something else. The key thing to remember about depression is it's not a mood that you can just think yourself out of. You cannot just say, "Acha, you just think positive and I'll come out of it," or just see. And that's what we do when we see someone who has depression. We think, "Why are you being like this?" You know, I felt sad too. You know, and we think it's weakness. We think it is laziness. We think it's bad. You know, just a bad attitude. What we have to understand is depression affects the brain, and the brain is an organ, which is a complex organ. And just like any other organ can malfunction, the brain, when it's stressed, and there's a lot of different things we'll talk about, I think, which are causing this stress on the brain.
Yes.
In people who are genetically vulnerable, and India has about 40% of our people have a genetic predisposition to depression.
Really?
40%. There's a very good study done by a US-based researcher who set out to find what is the prevalence of the depression gene. There's a gene which codes for something called serotonin in the brain.
Right.
And there is a variant of this gene that predisposes people to depression when they go through stress. Meaning that if you go through stress, you may suffer for a while, but you won't go through depression necessarily unless you have this gene and some other factors.
Sure.
They found that India has 40% genetics. So if we get into this, you know, certain kinds of stress, then potentially 40% of this country can have clinical depression. Now that's such a big number, people immediately dismiss that and say that can't be true. But even now we are seeing in urban areas, in corporate India, there are 2-3 studies saying depression prevalence in corporate India is 35 to 40% currently. So it is a huge problem, and it's not an obvious problem. You may be depressed, but nobody may ever know. You may not know that you're depressed.
Absolutely.
But it will impact your life and it will cause dysfunction.
So I think building on that and looking at the environment that is perpetuating something as serious as this, is it the mere urbanization of cities? Is it fast-pacing lifestyle choices? Is it complexities of human behavior? Is it just temperament? Is it disintegration of support systems? And very unfortunately, the smallest social unit, family, nuclear or joint, it is not there. And once upon a time, that was the starting peg of a cohesive social existence, where people felt the need to talk to one another, to discuss. Quietness was not randomly dismissed. So is all of that single-handedly responsible as a cumulative factor, or is it time for society like India with deep-rooted civilizational legacy to think, to develop a culture of prevention which has a holistic and an integrated approach? We don't know. The chit-chat here is going to take it forward. But my next question certainly stems from the fact that after depression, the next very obvious attention paid to is disorders, behavioral disorders. And here in India, synonymous with day-to-day living, issues of life, progression, everything is cinema. And in Indian cinema, ladies and gentlemen, I think a great many of you belong to the black and white era. Vintage films have given us expression of mental illnesses. Nargis in Raat Aur Din, the latest Pink, where Mr. Bachchan is experiencing a bipolar dysfunction, mainstream commercial cinema, Houseful 3, so on and so forth. So I am very curious to understand, as a practitioner, as a person who is specializing in mental health illnesses, do you see that are we being irresponsible in treating disassociative behavioral projections, or DIDs, identity disorders, on 70mm, very casually, in an exaggerated form?
I think one of the issues is that depression is not a very dramatic experience from the outside. Meaning, someone can have depression and they look perfectly okay, they're quiet. It's not good movie, It's not, doesn't make for a great movie. And so I think a writer or a director will try to dramatize mental illness so that people recognize it. And it's unfortunate because we only see the dramatic kinds of mental illnesses that are not so common. For example, you mentioned dissociative identity disorder. It used to be called multiple personality disorder. And in the 70s, there was a movie and a book in the US called Sybil,
right,
which made it a fashion almost among psychiatrists and psychologists there to diagnose multiple personality disorder. In fact, it's very uncommon, and some people even debate whether or not it really exists to that extent. But those are very uncommon conditions. I mean, the bulk of the thing of what troubles people is what we call common mental disorders, which are mainly depression and anxiety.
right.
And those are not very dramatic. It's in a sense an amplification of something that we've all felt, but much deeper than that and much less reversible in that sense by yourself. So I think that's why movies don't represent depression well, or they want to show something dramatic.
So perhaps a more sensitized approach is in place, and perhaps the young Turks who are coming in the medium need to have a bit of research work with experts like yourselves, or at least forums where there is an articulation and a more correct form of mental illness in terms of somebody being dismissed as pagal hai and showing him hyperventilating behind a barred window. It is not what a youngster today would like to even acknowledge.
I think the media reflects society in a lot of ways, and I think if I look at children, I notice that one of the first galis they use is pagal, from pagal ho. I don't know, I think there's something very deeply human about being scared of mental illness. I don't think anyone has to teach us that. I think right from when we are young, we're kind of scared about that. We use it as an accusation, as a form of abuse. Because the scariest thing for any human being is to lose your faculties, to lose control of your mind. And that is why we would rather not acknowledge this is a common problem. We'd rather blame the victim and say, that person is different from me. This will never happen to me. I want to make it clear, mental illness can happen and does happen to people from all walks of life. Absolutely. And to everybody, because the brain is so complex, the human mind is so complex, and we are living in very complex times. What are the reasons that people go through this? It's because look at how much we have changed in the last 15 years. Look at the way our culture has changed. And I'm not one to say, we have to return to our roots, and I'm not a big... But the point is that this society, we're a young country. They've done studies where they found that Indians are genetically predisposed to being collectivist.
Right.
The same gene that I was talking about that codifies for depression also codifies for collectivism. This is very fascinating. What they found was that every society that had this gene for depression is a collectivist society. China, 50-60% of this gene. India, 40% of this gene. America, 20% of this gene. Now, the point is, we didn't have as much depression as the United States, even though we had this risky gene. The reason was that our culture was protective. So in old school socialist India, we had a lot more time to spend with loved ones. Absolutely. Our aspirations were modest. We didn't compare ourselves, or we weren't envious of other people as much. We weren't always feeling dissatisfied about our life after going onto Facebook. We were fairly comfortable in our place in the world and in society. But now, because of globalization, because of the internet, because of capitalism, because of individualism, urbanization, what kind of lives do we live? We live disconnected from people. We're connected only on social media. We don't have time for authentic, real relationships. We are so focused on our careers and on getting, paying EMIs and the rat race. We don't have, we have pollution. We don't get access to sunlight. This is fortunate, but usually we don't get nature around us. We are in offices. So it's and our food habits have changed. So we're getting fast food or not, or processed food. You put all of this together, it is actually shocking that 50% don't have depression, to be honest. Because, look, let's look at what the animal model for depression is. It's very interesting, because the animals, many of you have pets, you look at the animal or a child, they're very beautiful in their innocence, right? They are beautiful in their innocence because, you have a dog or a cat or one of these animals, they live within instinctive boundaries. You will not have a dog that one day becomes Mahatma Gandhi or a dog that becomes Saddam Hussein, There's no despot murdering dog unless they have got rabies or some disease. Neither is there an enlightened dog. They all are pretty similar. Whereas human beings, look at us. We are all different. One of us could be great. We could do great things. We can do horrible things. The same person can do great things and horrible things.
Right.
Because our brain is very different. We have a part of our brain called the neocortex, which is unlike any other species, that allows us to take representations of ourselves and put it in different situations. No dog can do that. No animal can do that. Say, like, if I tomorrow am in Delhi, what will my life be like? If I join this college, what will my life be like? If I marry this person, these are things that we can think about. Now, what happens then is that our stress also becomes more subtle. For the dog, it's very simple. It's stressed if it doesn't get food, if someone hurts it. It's very clear. But if you look at a dog really slightly weirdly one day, it's not going to get neurotic and wonder if you like him or her. It doesn't care. It's not going to think about, am I being accepted or not? Or it doesn't say, wow, why am I here on this planet? Why was I born? These are not questions they have.
Right.
They're lucky. We have these questions. We have these subtle tensions all the time. And so the kind of insecurity the average human being feels today is not of physical threat, is not of, most of us are privileged, we are not going to go starving. But many people face subtle threat to your self-esteem, threat to your status, threat to the things that you hold dear, subtle things like that. Those cause very, similar kinds of changes in the brain, like what I'm going to tell you, which is what, scientists said, how can we create depression in animals? Because, they wanted to try antidepressant medicines first on animals before they give it to human beings. And this is the 70s when there were no animal rights and so on. So there were some very cruel experiments. There was what's called learned helplessness. So you take a dog and you chain it and you put it on an electric plate and you shock it. And obviously it'll try to run, but the chain will hold it back. And the experimenters will repeat this. They'll repeat it time and again until the dog does not get up, does not run. And then they remove the chain and shock the dog, and the dog still does not run even though it knows it's not chained. And that is called learned helplessness. That is the animal model for depression, and it's similar in human beings. If human beings face a situation that they desire, they want something or they don't want something and they cannot get it, and repeatedly they are frustrated, time and again they are frustrated, the invisible chain keeps yanking at them, eventually the brain will give up. When the brain gives up, it's what we call clinical depression. That even if reality changes, you cannot see it. But for us, it's not the chain, it's not the shock. The shock is the subtlety of the social environment we live in. The chain are all the restrictions that society and our own lives impose on us. So it's very subtle.
So evolution of the mind should not be misunderstood, or the chemical locha should not be overutilized or taken for granted. One has to be very cognitive about how this works, why a fault appears, and how to address it, which brings me to the third integral part, and that is treatment, or gaps in treatment and the impact. You have a tripod for treating mental illnesses vis-a-vis whom to go to. You have three-tiered mental health expert assistance. You have counselors, you have psychologists, and you have psychiatrists. Now all three, please correct me, Dr. Bhat, on this, perform different functions. What a counselor is going to suggest to you is not what a psychiatrist perhaps may agree on or endorse. But for a commoner to be discerning, or for a patient to understand the complexity or to use the right way, becomes cumbersome, at times difficult, and that's where I'd like you to highlight that given these three-layered treatment and the gaps in it, how does this impact the aspect of
That's a good
depression?
question, and actually it's probably four because you also have the body, right? And the issue is, unfortunately, there's a problem in the profession where different parts of treatment and understanding have been split up. So a psychologist has not gone to medical college; they have gone to the humanities, and they have learned what we call psychology, which is really about thoughts and feelings and human behavior. The psychiatrist is someone who's gone to medical college and then specialized in psychiatry, where they learn a lot of the biological underpinnings of mental health issues. So what happens in the brain, and of course the body to some extent. And unfortunately, in the last decade or so, psychiatrists have started moving away from psychology and very much into biology, starting to think of everything in terms of biological terms, you know. And less psychiatrists, very few psychiatrists today do psychotherapy, which is talk therapy.
Sure.
I think that's a huge mistake, and part of my work as a psychiatrist is to try to get psychiatrists interested in psychotherapy again. And personally, I practice a lot of psychotherapy as well as prescribe medicines where it's appropriate. Counseling is a loose term that we use in India more than any other place, and it really means a kind of a psychotherapy. But I think in India, people have the impression that a counselor is someone who gives you advice. And psychotherapy is not about giving advice, it's about trying to understand the hidden unconscious patterns of thinking and feeling that can cause you problems that you're not aware of.
Right.
So and then there's the body, as I said. I mean, everyone knows, and any person sitting here knows that when you feel something, you feel it in your body. If you feel upset, you feel your body change. If you feel angry, scared, whatever you feel, there is something in your body that changes. And yet, psychiatrists rarely talk about the body, you know.
Yes.
Whereas if you look at Indian traditional medicine like yoga and Ayurveda, we spend a lot of time using the body to change the mental state. So if you look at Shirodhara or massage, for example, those are actually strategies to change the mental state. So the ideal approach is one, unfortunately, that does not exist in any country, which is a true integration of these different elements: psychology, the brain, the body, principles from yoga and Ayurveda, from spirituality, meditation. And you have to weave all that together in your understanding and treatment of the condition. So the problem is, as somebody said, if all you have is a hammer, everything looks like a nail. You know, so if a person comes with depression, you go to a psychiatrist, psychiatrist will say, look, you have depression because your left prefrontal cortex is not working. And he's right. If you do a brain scan, the left prefrontal cortex is not working. You go to the psychologist, they'll say, depending on the orientation, the Freudian may say, you know, you had problems with your mom and she didn't really nurture you, that's why you have depression. The cognitive therapist will say that you have automatic thoughts. These negative thoughts cause your bad feelings. The Jungian person will say X, Y, Z. The Vedanta person will say you're not detached enough. It's all true. It is all true. The point is, we have to weave together all of that and come up with what is right for that individual. And so it is labor intensive. It's not like, you know, every other field of medicine. You have an infection, write the antibiotic, you're done. Right? That's why a lot of doctors don't want to do psychiatry because it's not precise, results are hard to get. But I think that's the amazing thing about this. Human beings are so complex, there's no simple answer.
Sure. Interestingly, a recent survey conducted in England showed that there is a new phenomenon on the road which is called suspended adulthood. What is suspended adulthood? Age bracket 18 to 30. Is suffering from a complex leading to anxiety and depression and stress-related mental illnesses arising from simple facts of living with their parents. So if you're 29 and if you're living with your mom and dad, it is somewhere leading you to believe less in yourself. No confidence, bad job performance. So in wake of such phenomenon, there is another variable that constantly resurfaces in the discourse of mental health illnesses, and that is guilt. And unfortunately, once again, in urban spaces, especially in middle stratum, we are very reckless we do not understand that guilt is not a bad thing, something that should just be dismissed. It needs to be addressed, it needs to be taken note of, it needs to be understood, and you need to go into the root of it. So, Dr. Bhat, once again, this factor also is related to depression and stress. So how would you tell a patient of depression to rid himself of a guilt, that low self-esteem, that confidence which is broken? Yes, the meds may help, yes, counseling will help, but this incessant feeling of guilt, I'm guilty of not being good enough for what mom thought I should have been, or what my peers, or the sibling comparison, or whatever it be.
One of the symptoms, if you look at the criteria for major depressive disorder, is inappropriate guilt. And in some cases, it can become really delusional and pathological, where people with severe depression can feel so guilty that, I have cases where someone might say that all the bad things in the world are because of me.
Right.
But less floridly, people can have mild guilt and saying, I should. But I think firstly, let's differentiate between guilt and shame. Guilt is a feeling that I have done something wrong. And guilt is actually a useful emotion. It helps us correct ourselves when we are not acted in accordance with our principles and our values. And guilt is healthy to that extent, saying, when you feel guilty, you ask yourself, why am I feeling guilty? Did I go against some of my principles and values? People who don't feel any guilt whatsoever are people we call, sociopaths, who have no remorse, no guilt. They can do anything and never feel bad. I mean, those are scary people. And unfortunately, very few human beings are like that. Some of them become presidents, never mind. But, well, so it's very common actually for people like that to rise high, because that kind of ruthlessness helps in certain professions like politics. But anyway, I'm getting digressing. So the guilt is really this feeling that I have done something wrong, and that's a good thing. But a more painful thing is something that's pathological, which is shame. Shame is the feeling that I am wrong, that there's something wrong with me. And we have to differentiate that, Unfortunately, I think some of the parenting styles in India was very shame-based parenting. And that goes back to our collectivist days, shame on you, log kya kahenge, kya yaar, have some shame, what about your family name, all of these things were part of our culture, and as self-imposed criticism and saying that we should be perfect, don't allow themselves to make any mistakes, hold themselves to very high standards, like in that sense, and it's liberating to say, look, it's a short life, do your best, and live by your values, keep course correcting, but at no point, as long as you're a reasonable human, at no point should you feel that there is anything wrong with you intrinsically as a human being. So one of the philosophies of psychotherapy, the humanistic philosophy, is that we are all essentially valuable and equal as human beings.
Sure.
And that's the affirmation that through therapy we hope to give someone, that maybe they didn't get as children, maybe they didn't integrate that in their head. And so therapy, as I said, is not about telling that person something, but through a process, through that interaction, slowly a person can integrate that feeling, saying, yeah, there's nothing essentially wrong with me. I can free myself from the self-criticism, and life can be easier again.
Quite naturally, linked to the title of this book, and this is Dr. Shyam Bhat's maiden effort in becoming an author. Interestingly, You Will Love Again, a guide to healing from heartbreak. I'm interested in knowing heartbreak is often perceived during adolescence and the time that you really are trying to find your bearings, and you're not as responsible as an adult would be. So a crush and an infatuation is often termed as, I'm going through this phase where I don't know, I think my heart is not with me. But your book, though it talks about love lost once and don't give up on that, and issues obviously related to that vis-a-vis mental health. But in general, I think my experience of reading this book was that any page is reflective of life per se, that human sphere and the activities involved on a day-to-day basis are essentially revolving around this beautiful four-letter word, love. And manifestation of that needs to be more emphatic, more multidimensional. So let me ask you, how did the book come about? And I'm not going to be curious about the name that you have very discreetly stated you are not sharing. To the woman who broke my heart, you are, it's plural.
It's women, it's plural. So
Well,
it's a long list.
I'm not wearing my specs. All right. You taught me what books can't teach about love and loss. Do share how this book came about.
Yeah, no, it didn't really come from my own personal anguish, which was many years ago, about 2 decades ago, I think. But the reason I wrote this book, couple of things. One is that when I used to go to colleges and give talks about depression and how to prevent depression, the fact that we are facing an epidemic. And after this talk, where I would, talk about lots of research studies, people would come up to me and ask, the one question they would ask me is, how do I get over my breakup? That's all they wanted to know. How do I get over it? They said, forget about depression. So, obviously, when I looked at it a little closely, I realized that, look, the first onset of major depressive disorder, by the way, stress is often a precipitant of major depressive disorder. So you can have stress and just normally feel sad, or that stress can cause something called depression.
Sure.
Now, one of the most common stressors for young people is heartbreak, and that actually causes more than 25,000 deaths in this country. So when I realized how serious this was, number one. Number two, that nobody is talking about it from a, from a more scientific, rational, serious kind of perspective. And the cover, notwithstanding, it's a serious book. The cover makes it look a little Mills and Bunish. Please don't judge this book or any book by its cover. So I want to write a fairly serious book that would address the issues. And then I thought back to my own life when I was in my 20s, went through a breakup. And it was very painful for me. And I remember at that time I couldn't talk to anyone. My parents they have an arranged marriage. What am I going to tell them, They'll say it's just puppy love, whatever, get over it. Can't talk to anybody. Like, who can you talk to? You can talk to an old cousin who will give you some horrible advice. So so that's why I wrote this book. I said I want to write a book that I would have liked to read when I was younger. And I also saw that any suffering, and this is my, I think a guiding principle, that any suffering helps us transform positively, and the more deep the suffering, the more painful it is, the more the potential for transformation. That is when we really transform. As long as you're reasonably happy, you're not going to change. Maybe you don't have to change, I'm not saying you have to, but when life throws something at you that is deep, that is difficult, you can do one of two things. You can not change and just cope and harden yourself, which is what my thesis is, that a lot of people who are older are cynical about love because sometime in their life, when they were younger, they went through some kind of heartbreak, some kind of betrayal, and they have hardened themselves to the fact that love, as you said, is absolutely, vitally, centrally important in life. And yet as intellectuals, we don't talk about love as poetry, right? We know, or literature a little bit, but doctors don't talk about love.
Right.
So even though it's quite clearly the most fundamental, most important emotion for humans. If you talk to someone at the end of their life, and a lot of studies looking at at the end of our life, what do we look back and say, what do we say is valuable? It's only love. It's only the love we shared and the people who loved us. Everything else is meaningless in the last few moments of our life. So clearly, I want to elevate the discussion of love a little bit more, and
So
I
can
hope
we
it helps.
request you to share your
Sure.
favorite extracts?
I
or
don't
some
know what favorite. Let
passages?
me randomly pick something. Let's see. Right. I think I'll talk about self-concept maybe, or self-esteem. Sure. All right. I'll just talk a little bit about self-esteem because I think that's very critical. Self-esteem. You're a good and valuable person. You are beautiful and lovable. You are perfect in your imperfections. If you are going through heartbreak, you may not believe these statements. Rejection, unrequited love, and pain have made you feel you're not worthy, not lovable, that there is something deficient about you. Negative thoughts like I'm not good enough, nobody loves me, or nobody will love me like he or she did are painfully common. Why do you feel bad about yourself after a breakup? Why does heartbreak leave you feeling that there is something wrong with you? To understand this, you have to understand how you derive your self-worth in the first place. You feel badly about yourself now because your loved one's judgment of you became more believable to you than your own opinion of yourself. These bad feelings are much worse if your self-esteem was low even before your breakup. When we don't feel good about ourselves, we become even more addicted to love or a semblance of love to make us feel valued. Low self-esteem causes people to stay on in bad and abusive relationships since they don't believe that they deserve any better. Improving your self-esteem is the most powerful way in which you can heal your heartbreak. And then I go on to discussing how you can do that.
While writing this book, any revelation that as a practitioner you felt was refreshing from an author to somebody who is on a daily basis listening to cases? Was there something as a new insight as a writer while penning this book and as somebody who's sitting at the desk and meeting patients one after the other and perhaps hearing the same stories again and again?
No, I think this was a distillation of the insights I'd gained from my job, from my work, and from my own sort of self-analysis. One of the occupational hazards is that you can't escape your own analysis.
True.
So, I'm very grateful to people, and I say that in my book as well, to people. I feel enormously privileged to be a psychiatrist because I've always been very fascinated by people, and I feel very privileged that people trust me enough to share their most intimate stories, and that gives me a window into life, and I think it's a continual journey. I can't say I've understood human beings completely. I don't think anyone ever will. And that's why it's so amazing, because after all these years, I will always hear something new, something different. And every person I meet, in that sense, although many things are similar, and that's why we can write a book, everyone is different.
Sure. Well, ladies and gentlemen, it's been not only informative, exciting, but personally enriching to be in conversation with somebody as learned and as experienced as Dr. Shyam Bhat. In my summing up, I found some lines from a column that I wrote a couple of years ago, and it was appropriately titled then, Mind Talks. So kindly bear with me. I will just conclude our conversation with what I wrote a few years back. With scientific innovations having unraveled only segments of the many hidden secrets of our universe, it is possible that complete comprehension of the human mind, along its myriad intricacies or mysteries, also remains a realm largely unexplained and open to perseverance and research. As Hannah Green said once, health is not simply the absence of sickness. Thank you very much for your patience. Thank you, Dr. Shyam Bhat. It has been a pleasure and a privilege to host you in Chandigarh.
Thank you.
And Dr. Shyam Bhat's book is available with us at the Capital stall, and he would be there to sign it. Before we leave the stage, we just have time for about 3 questions very quickly. Yes, please. The mic to the gentleman with the black jacket there. Right at the end.
I'm just intrigued to ask what makes you depressed and how do you feel with it? How do you deal with it actually?
Well, the first thing is I think we need to use that word carefully. If depression, the way I use the word is that it's a condition that needs treatment. So if you ask me what makes me sad or what makes me different things, I mean, I'm not immune to sadness. In fact, one of the things of my profession is it can get pretty emotionally intense, and we pick up emotions from the people we care for. It's called emotional contagion. If you've ever been with a family member who you care for and they've told you about their pain, when you leave that, you feel a little pain. And so, for me, a daily process is actually coming back after my clinic to go through some meditation or physical exercise to let go of all the stories that I've heard, and because it's also a responsibility. It's not just that session, but it's also thinking about what they're feeling, how can I help them. That actually, sometimes when I hear a particularly difficult life story, it both amazes me about the strength of the human spirit. What people you will not, it amazes me how much courage and strength there is in, I think, every one of us. If we face something difficult, I've seen people just respond with the most amazing strength. So it inspires me, but it also saddens me to hear some stories of what people can do to each other. I think it saddens me occasionally when, like all of us, you hear the news, and I think injustice is something that really saddens me, and sometimes you feel that there's so much left to do and so little time, and how much can, but I think those are things that occasionally I feel, but I return to what I can do and what I can change and the connections, and that makes me feel better.
Next question.
Hi, Nikhil here. Just wanted to ask you one question. Is good mind a solution to bad mind, or is solution going beyond mind?
Can you clarify what you mean by good mind and bad mind?
My close. Uh, when you are in depression, you normally say that you are in bad or you're not in very good state of mind. So one is that through affirmations and all these drugs or whatever, you are trying to convert it into a good mind. So my question is that the answer, or is the answer going beyond mind?
When you say beyond mind, what do you mean?
I'll have to write a book now.
I want to be sure what your question before I answer it.
So it is, basically in a yogic tradition.
Achha, you're talking about...
Yeah, and in meditation, the whole idea is to, just...
transcend the individual, okay. So, first of all, I wouldn't use the words good and bad. I would say, is it functional or dysfunctional? And, I use a lot of meditation in my practice. I incorporate a lot of philosophy of Vedanta and the idea of the self. And I think that those are very deep, both philosophies and practices to help in cases of depression and anxiety, because a lot of depression and anxiety obviously comes because of our attachment to the things that we hold dear. That the more wedded we are to certain ideas, the more threatened we can feel by life. And to surrender all of that, either through meditation and various other practices, to be in touch with sort of the non-dual transcendental self is very healing. Having said that, when someone comes with depression, see, I think from an Indian philosophy, mystical standpoint, there is this feeling it will help everybody and anybody, that come and meditate and immerse yourself in non-duality and you will be okay. That's not true, because even when you look at the texts, these were texts written for the average person, not someone who's going through something called depression. Today, depression has become very common, as I said, and for them, we cannot go straight into meditation and say, let go of everything, that you don't exist and that you are the cosmic self. We have to be pragmatic. So the first thing I say is, look, you're not going to get a gold medal for going through life without a medicine. If someone is suffering, and they are really suffering, and believe me, it is a suffering with mortality, then I would treat it just as I would treat someone with an infection, diabetes, a fracture. In none of those cases I would tell them, like we have a treatment called antibiotic, but let's try some meditation first. We wouldn't do that. We would not do that, because scientifically we know it is like, if sure, meditation has boosted the immune system, absolutely. But if someone has a septic shock, someone has infection, I know they're going to get better with an antibiotic. I'm going to be pragmatic and treat it. Same thing with depression. I don't expect that person to be any more spiritually, I don't expect, put any more pressure on that person than I would anyone else. We have to balance the risk and benefit of every treatment. And like I said, it has to be integrated. We would ultimately try to integrate all of that, because if you look at prevention, once an episode of depression is treated, there is a risk of relapse. We have to prevent further episodes. For that, we look at lifestyle, we look at relationships, we look at the person's narrative of who you are. Who do you think you are? And if you look at the individual self, Eastern philosophy tells us it's all Maya. Leave your individual self, connect with the bliss that is the cosmos. However, the individual self is the self I use to operate in the real world. And if that individual self has erroneous ideas, someone who says I have to be perfect, to use the old example, someone who says I have to dominate over the world to be happy, or all kinds of misconceptions we can have, then I would address those individual misconceptions while side by side introducing them to the idea of that the individual self perhaps is only one way of living in the world, and you can connect with, as you said, going beyond the mind. So it's not an either or. It depends on each case, depends where they are, depends on their intellectual development, so many factors, to be honest. And I think that pragmatism is important. The person needs to live a good quality of life. They need to be able to fulfill their potential while they're here. We're not here to numb feelings or to suppress feelings. That's not the role of psychiatry, and I want to underline that. Medicines are not meant to suppress feelings. It's a common misconception in this country. They're not happy pills. If I didn't have depression and I took this, it wouldn't make me any happier. They're not going to boost your happiness. They alleviate something that is pathological. And we know now with a lot of research that depression causes atrophy of the brain, degeneration of neurons, there are real structural changes in the brain. This is a neurological condition as much as a psychological one.
Two quick questions. Make them really brief, please. Thank
Okay,
you.
okay. Sir, I want to ask you that we get so much of teachings from some other persons. Like every person has to simplify our life. We go through meditation, we go through fresh fruits, fresh eating habits, and waking up early, going for everything. But we have the patience for it. We don't want to achieve something. We have that. And you compared our life as a dog and a cat. But something teaches us in classes we have that we have the selection I part, intellectual part in us. They don't have that, so it makes us something different from them. So if you want to summarize the life, you said that there is no purpose of life, why, what you are born for, or you don't have to find that. So to make it a simple, to make the life simplify, not this much of complex. So what should you want to tell us about the purpose of life, or how you handle your life? What you want from your life?
I'm not sure.
What is the simplest advice I can give?
Yeah, to simplify
through
the
all of
life.
that, yeah.
To not to make it complex. But
That is exactly the advice. I would say simplify your life.
yes, sir.
That's my. You answered your own question. I mean, basically, what I would say, see, the complexity comes because our brain and mind, like the reason I compared the animal is blissful as long as the surroundings are okay. But the animal doesn't have autonomy. If the animal was with the owner who's beating it every day, it cannot leave the house and go. It doesn't. It cannot. It doesn't have autonomy. We, God or nature, gave us autonomy, but also gave us the curse of this brain. This is a blessing and a curse. It's because of this brain that we can talk, we can have a literary festival, all of these things. But it's because of the brain that we suffer. We suffer the torments of our own desires and our own thoughts. So the way is to, in fact, one old treatment, which is not a treatment, it was a gruesome thing, but it was done in the 60s in the United States, and the person who invented this got a Nobel Prize for it. It was called a lobotomy, where they would remove the frontal lobe of your brain to cure mental illness. And it cured mental illness, it also removed, changed who you were. But people who are really troubled suddenly they almost looked like they were sannyasis in bliss, So the key is to know that what you feel and what you think is not you, it's your brain and your mind. And that is why meditation is useful, for example. So I would say, to keep it simple, if you can stay in the present moment and live your life without, unnecessary anger or regret, moderate your desires, everything else will just flow. Now, it's easier said than done, frankly. Simplicity doesn't come naturally to human beings. So yes, the answer is simplify your life, let go of everything that is not unimportant, focus on what's happening right now. But it's easier said than done, I think, because of our brain. We're just not made like that.
The gentleman in the blue turban and
to depression because he does not know his limitations, or still he wants to achieve a certain kind of life. And sometimes you go into depression when you come to know yourself, you come to know your limitations, you know what you can do, what you can't do, but still you want to achieve a certain kind of life, but it is helplessness, you cannot achieve it. Then how do you treat that thing?
I think the key is that the reason that the person who feels depressed when they don't achieve, and you're very right, by the way, this is a very common issue, especially among young people. I think we live in such a difficult world for young people. Every day they open on Facebook and they see someone who's mega successful. Mark Zuckerberg is like younger than all of us, the standards have become, by the time you're 30, if you're not a success, you already think you're old. It's ridiculous. So there is a lot of pressure people are putting on themselves. But the key is the misconception, or rather the idea that my self-worth, how valuable I am, is based on a result, on what happens, whether I succeed or not. It is perfectly okay to desire success and to chase success as long as one doesn't make the mistake of conflating, of saying that my self-worth is dependent on that. And this goes back to the most ancient advice ever in the Gita, right? Which is what Krishna was telling Arjuna. He said, do what you have to do, but never take your self-worth. He didn't say self-worth, but I think that's basically what he was trying to say. Don't believe that who you are is dependent on something that you cannot control. And I think that is key. So if a person says, look, I didn't get what I wanted, but I'm willing to try again, and to know that you can keep trying, as long as I take my own self-worth out of it. I'm the same whether I'm successful or not, or I'm rich or poor. I will not be changed, and that is so important. And that is the root of our spiritual tradition. That is what community gave us. That is what our neighbors, our friends, our family, because they treated us the same, no matter whether we were rich or poor in the old days. And that's what we have lost in this culture today. Today we treat each other a lot based on, what car you drive, how much money you have, etc., etc. And I think that's fine. Let society do that. But each one of us must stop, must pause and say, that's noise. What's my relationship with myself? What's my relationship with the people I love? And that should be kept simple and just on humanity, I think.
And that closes this session because we have one more session on Punjabi cinema. After this, Dr. Bhat is available, ladies and gentlemen, at the bookstall. Do bear with us. We are strictly following timelines only for your pleasure here. We have a cultural evening with Radhika Vaz, so I'm afraid I'm going to have to close it now, and he will be available at the bookstall. Thank you ever so much.
Thank you very much. Thank you.
Thank you.